My name is Sharon Mitchell. I'm a nursing student with UT Arlington in the master's program, and today we're working on the teaching and learning theories and strategies and evaluations class. The theory that I'm going to be concentrating on today is the adult learning theory. This theory is coined by Dr. Lieb, and he explains it uses approaches to learning that are problem-based and collaborative rather than didactic, and also emphasizes more equality between the teacher and the learning. In other words, they want to say that most of the people in your classes are well educated and have experience, and you want to use that life experience to make sure that the class is enriched by the topic that you're talking about. There's 6 theories in this principle. Adults are internally motivated and self-directed. Adults bring life experience and knowledge to learning experiences. Adults are goal-oriented. Adults are relevancy-oriented. And adults are practical, and adult learners like to be respected. So most of the classes that are given in this particular strategy are classes that adults are choosing to take, not that they have to take. So they want to be motivated to receive the information that is being offered, and they don't want to be talked down to. So today what I'm going to do is the strategy of role-playing in coaching and communication. I'm going to give 2 scenarios to leadership here throughout our health system. And we have charge nurses, educators, we have nurse managers in the room, and they're going to discuss ways to coach and communicate effectively with the nurses on the floor. First, we're going to show the scenario of role-playing of the wrong way to communicate in this particular facility. Okay.
Okay, what's your name again?
See that?
Miss K. Okay, Miss K, do you know why I'm calling you in here?
No, ma'am.
Okay, so they're saying that there was some type of situation that happened on the unit. Can you tell me about it?
Well, you tell me. You call me in the office.
It was last night. Miss Joseph said that somebody took your candy.
Well, she shouldn't have took it.
No, she said somebody else took your candy. Can you tell me what happened after that?
Ma'am, let me tell you something. Look, I got stuff to do. Can you tell me what you need?
Okay.
I'm confused.
I'll tell you what I need.
Okay.
So I heard you calling some folks out of their name.
Well.
And you know that that's not how we roll around here.
Well, how do we roll?
Okay, ma'am. You cannot call no one no fat. Okay.
Well, you know, that was on her badge at that time.
Excuse me?
I'm just saying.
Hang on. I'm going to call somebody.
Well, you want me to come back?
No, ma'am. You going to sit right there.
Okay.
Okay. So we need to get along with each other. We can't have this.
I need to come here.
Ma'am, we cannot have this foolishness on this unit, okay?
Okay.
We cannot function like that.
Well,
I'm going to need you to act your age.
Oh! Okay.
Okay. Okay. Now, next time did you put your name on your food?
I mean, I didn't think I should have to. I mean, when
Yes.
I bought it, my receipt said it was mine.
No, ma'am. You need to put your name on your food, date, and labeled, okay? If not, nobody else knows that it belongs to you. Okay? And if this foolishness happens again, we're going to have to take... Yes. Calling people out of your name, we're going to have to take care of this situation. Okay? Please do not do this anymore.
Well, you need to talk to her, too, because, you know what I'm
Ma'am,
saying? You just can't call me in the office because of some nonsense like this. It's not just me.
Miss K.
Ooh, she done called me
Please
Miss
lower
K
your
2
voice.
times. That's not my name. Okay, but okay. But you make it.
Okay? Next time, there will be consequences.
Okay.
Okay?
Okay.
All right. Thank you.
Now you've had a chance to see the wrong way how to communicate at this campus, and next we're going to show you the correct way to complete a coaching or communication with any nurse on the unit. So LaDonna's going to show us how to do that.
Hey, Miss LaDonna.
How are you doing?
I'm so good. How you doing?
I'm good. How's everything going on in you?
It's wonderful.
Okay. The reason why I called you in today is because I want to talk about maybe an experience that you had with one of the employees a couple of days ago.
Okay.
Can you tell me about what happened?
Which one? in particular?
Well, in particular, I had a couple complaints about employees saying that maybe we're calling her out of her name, and I don't know if that was a misunderstanding or there was something else going on. So I want to get your side of it so we can reach a resolution, and then you can tell me maybe what I can do to help you to make the unit better, to make yourself happier.
You know, she just took my candy. And you know, I took extra time and got dressed early and left, got to the gas station and got that candy myself. So I felt really just a slap in my face when she touched my stuff. So I had to, you know, let her know how I felt at that time.
So what do you think that you could have done differently?
Absolutely nothing.
Do you think that maybe there's some times where people can push your buttons and maybe sometimes we say things in anger that we don't really mean? Sometimes we can count to 10. I know myself, if I get angry, I have to walk out of the office, maybe count to 10 or 12 and look into myself and see what else is going on.
Well, I mean, I could have done that. I didn't think about it that way.
Would you be willing to maybe go to emotional intelligence? I know that they have a lot of people in leadership in this class because we deal with different personalities. And when you deal with different personalities, not everyone is the same as you. So they can kind of push your buttons. This class, if you go to it, they're going to give you a book. It tells you how to deal with your emotions. And then we can come back in a couple of months and discuss if you use some of the strategies. And it will be a learning experience for you.
Well, do I get paid for this class?
You will get paid for
Okay, I
it.
can go. Sure.
Okay, good. And what we'll do is we'll do a small performance improvement, and that emotional intelligence will address that class. We'll come back and see how you're doing in 3 months. But just remember, if you have an issue, the first thing you need to do is take a deep breath, try to calm yourself, and then if you don't feel like you can answer appropriately, you have your charge nurse, and you always can come to your manager.
Okay.
Don't feel like you can.
Okay.
Do you have anything else that I can help you with?
No, that's okay.
Okay, good job.
Thank you.
Okay, ladies, I want to thank you first of all for participating. So, can you guys tell me, you know, what you got from this particular role playing and strategies that we talked about today?
Devita, what did you get from it?
Communication is key. Proper communication and know who you're dealing with when you're talking to that person is a key to success in conversation.
You think you brought your experience levels to this particular class?
Absolutely not.
Absolutely not.
I think she did a great job.
What about you, LaDonna?
I just think that it's hard already to be a manager or a leader because being called in the manager's office is not necessarily a bad thing, but people can perceive that it is. So you have to be as least threatening as possible, and you need to get both sides and weigh the evidence before you make a conclusion. And then you need to let the person have input on what they think that their, I guess, punishment or their corrective action should be.
Okay. Thank you so much. What about you, Rosario?
Just to piggyback on what LaDonna said, it is key to allow the employee to kind of have input and to allow them to make the first step, or let them to take the first step and initiative and to take action, you know, to correct their behavior, provide them undivided attention. You know, you can't be messing with your gadgets, you know.
Right.
So when it's time for them and that counseling, you need to focus on them and just listen to the entire story and get the entire picture. That way you can come to a good conclusion.
Okay. All right. Thank you, ladies. Thank you so much for participating. This was fun.
Everybody.